Good morning, good afternoon, doctors, nurses, and pharmacists. If you can hear me, please just let me know. Let us start the class. Okay, if you can hear me, just let me know. Okay, so I just got a little bit late. Okay, so just let me share the session, then we will start. Okay. Sometimes I can get a little bit late, as you know, I'm a working doctor, so sometimes we have patients. Okay, just let me finish today. We will do writing. Tomorrow we will do today reading. Tomorrow we will do writing, and on Sunday we will do uh, speaking. Okay, thank you so much, all of you. Just let me start. So can you see my screen? Okay. Just let me start now. So part A, reading part A, just quickly, I will tell quickly, okay? Just let me tell quickly that we need to quickly skim and scan the main information headings, subheadings, and these things. Okay, and then go for the questions and read the questions and try to answer as soon as possible. The main thing in reading part A is time management. Time management. Okay, so if you cannot manage the time, if you cannot answer the question in 15 minutes, then it would be very difficult for you to pass the exam, because reading part A is the key to success. Okay, so as you know, yesterday we have done skimming and scanning. Okay, so I have told you that first we need to skim and scan. Okay, okay, skim and scan. So just let me quickly do, maybe someone is new today, just quickly we need to complete today this reading part A. Okay, so quickly skim and scan, quickly skim and scan. Okay, so number one, this is omeprazole. As all of you know that this is PPI. Okay, so then this is overall general information about omeprazole, how the acid is produced, how acid reflux is produced, then how proton pump inhibitors work, okay, by stopping the cells in the line of stomach from producing acid, okay, H. pylori and these things, and where we can get the prescription in pharmacy and these things. This is algorithm what to do in case of refractory GERD. We first give PPI once daily, then review then start giving twice daily for 2 months, then do these tests. Then if not, these tests are not available, go for empirical therapy. So if this is negative, what to do? If it is positive, what to do? If it is weak positive, what to do? And heartburn and what to do in this case. Then we are cautions when we use PPIs, what cautionary measures we need to take, okay? If there is diarrhea, what to do? Liver disease, if there is lupus erythematosus disease, gastric carcinoid tumors, okay? It decreases efficacy of clopidogrel, then nephritis, and here is the gastric malignancy, and here is uh, prolonged use and toxicity, okay? Then we have a text D. In text D, we have long-term use and pregnancy and breastfeeding. In long-term use, if we use PPI for a long time, what we can have, okay? No association between PPI use and cancer, but serious gastric problems physicians should be aware of. There is one study here, okay, but calcium and magnesium association between calcium and magnesium and PPI. What to do in pregnancy, we should give or not. Omeprazole high protein binding, and omeprazole needs to be administered in entire coating. Okay, so all of these things. So overall, skimming and scanning here is that in part A, we have overall about omeprazole. In part B, we have how to do, how to treat and diagnose refractory GERD, then cautions during the use of PPI, and then we have in text the long-term use and breast feeding and pregnancy. Okay, this is just quick skimming and scanning. So how much time we should spend on skimming and scanning quickly, please? Okay, so we have done yesterday question number 11. We will now continue with question number 12. Okay, 1 to 2 minutes, very good. Very good. 1 to 2 minutes, excellent. Okay. Okay, thank you, new people. Thank you. 15 minutes. No, 15 minutes is in total. And for skimming and scanning is 1 to 2 minutes. So the question is a defect in what at the upper level of stomach causes heartburn? A defect in what at the upper level of stomach causes heartburn? In which text it is possible to find the answer? In which text? In which text it is possible to find the answer? A defect in what at the upper level of stomach causes heartburn? Where it is possible? In which text? Okay. In which text it is possible? In which text? A defect in what at the upper level of stomach causes heartburn? Very good. So most of you are saying it is part A. So let us go to part A. Then you people will find the answer. Okay, let me know in which line or which paragraph you can find the answer. Okay, let me copy the question. Here. Here is the question and here is the text. Quickly, please. What is the answer? So what is the answer, please, quickly? A defect in what at the upper level of stomach causes heartburn? What is the answer? This is fill in the blank. You need to fill in the blank, okay? Fill in the blank. What is the answer? Esophagus, very good. Esophagus. Esophagus, very good, excellent, excellent. Top of stomach. Top of stomach is already written. Upper level of stomach is already written. Muscular band, very good. Top of stomach, very good. Esophagus, very good, excellent. Muscular mucosal barrier, very good. Muscular band, very good. Esophagus, very good, excellent, excellent. You people are genius. Genius doctors and nurses are here. Very good, very good, very good, excellent. Excellent, very good. So majority of you are saying it is esophagus. Some of you muscular band, and one person said that top of stomach, but majority is saying that it is esophagus. Very good, excellent. Anybody else wants to participate? What should be the answer? Anybody else? Nothing? Okay, now let us try to find the answer, okay? So a defect in what at the upper level of stomach causes heartburn? So majority of you are saying esophagus. Please, please. Acid reflux, no. Please do not use your medical knowledge in OET to give the answers in reading, especially in reading. Don't use your medical knowledge. Find the exact word. Match the keywords, okay? Match the keywords. Match the keywords, please, keywords. So a defect is one keyword. A defect, one keyword at the upper level of stomach, and that causes heartburn, okay? Defect in something at the upper level of stomach causes heartburn, okay? Now let us read from here. Some people are saying this barrier can break, and this is not here. This mucosa barrier, no, because irritant, your body produces a natural mucosal barrier which protects lining, and some the barrier can break down, allowing the acid to damage the stomach, causing inflammation. This is other thing. So over keywords match here, okay? Other people can have a problem, can have a problem. Other people can have a problem. What is the synonym of problem? What is the synonym of problem? Other people can have a problem. Some defect, some problem. Okay. With the muscular band at the top of stomach, at the top of stomach, upper level of stomach. Defect, problem in what? Muscular band, okay, problem that keeps the stomach tightly closed. This is the band that keeps the stomach tightly closed. This may allow the acid to escape and irritate the esophagus. The problem is not defect in the esophagus. This irritates esophagus. This muscular band, when there is problem with muscular band, which muscular band, which is at the top of stomach and keeps the stomach tightly closed. This means this problem in with muscular band. This allows the acid to escape and irritate the esophagus, causing heartburn. This is often referred as acid reflux. So what is the answer now? What is the answer? A defect in what at the upper level of stomach causes heartburn. Esophagus is complete esophagus. I'm talking about a defect at the upper level of stomach causes heartburn. A defect in what? What is the answer? What is the answer? What is the answer? So the answer is muscular band. Okay. People, believe me, is this difficult? Is this question difficult? Is this question difficult? Is this question difficult? No, not at all. This is not difficult. You just need to know, just do critical analysis. So all of you, most of you have made the mistake. This is not esophagus. This is tricky. Yes, that is good. Tricky. Okay. So you need to just, just, focus, concentrate what the examiner wants from you. Just focus on that, please. This is the real reading exam. If you go superficially, you will give answer esophagus. If you just concentrate a little bit, a defect in what at the upper level causes heartburn, it leads to heartburn, but what is at the start? Problem with muscular band. So please focus. If you keep doing a lot of reading sample, especially nurses, if you keep doing a lot of reading sample, at the end your score is the same. Okay, your score is the same. The problem is you people don't do critical analysis. You don't focus what the examiner wants. So these are samples are written by myself. I have made these samples. I know what I want from the students, where I'm little bit tricky, where I want them to judge and to examine them, where they are good in reading or not. Okay, so please be careful. Not all the questions are tricky, just a few are tricky in the exam. These tricky questions make you pass or fail. Okay, the next question is, by taking omeprazole, the chance of dash might exist even if symptoms are relieved by its use. By taking omeprazole, the chances of dash might exist even if symptoms are relieved by its use. In which text it is possible? In which text? In which text it is possible? In which text it is possible to find the answer to this question? In C or D, A or B? In which text? In which text it is possible to find the answer to this question? In A. Why in A? Because in A they are talking about, in A, don't use your pre-knowledge. Please do not use your medical knowledge. Try to find the answer. Otherwise, you will be giving wrong answers. Please. Without reading the text, you cannot give the answer. Okay. So it is possible in C or D, because in C they're talking about cautions, in D they're talking about long-term use. Okay. So now let us go to uh, D. Okay. Try to find here. So this is the question. Let me show you the question. What is the answer? Quickly, please. What is the answer? What is the answer? Fill in the blank. Chances of birth defect. No, they're not talking about birth defects and these things. No, try to find the answer here. Please. This is the whole text, please. This is the text. This is the text. This one. Very good. Stomach acid cancer. Okay. Somebody is angry. Okay. Let me try to find the answer because I have made these samples a long time ago. So strongly associated development of benign polyps from the which is distinct from these polyps do not cause cancer. They resolve when PPI are discontinued. But the chances of DASH might exist even if symptoms are relieved by its use. Resolve when PPI are discontinued. No association between PPI and cancer, but use of PPI may cause gastric cancer or other system. Physicians should be aware of it. Okay. Okay, here. There is association. Just let me just see quickly, please. Okay. Okay. So the answer is here. By taking omeprazole, okay, by taking omeprazole, the chances of DASH might exist even if symptoms are relieved by its use. Okay. So what is the final answer? Is not cancer, is not cancer, is benign polyps. The answer is benign polyps. The answer is benign polyps. This is the answer. You can see there is no association between PPI use and cancer. There is no association, so it is wrong. Cancer cannot develop. By taking omeprazole, the chances of dash, chances of benign polyps can exist. Okay, there is strong association with the development of benign polyps. These polyps do not cause cancer and resolve when PPIs are discontinued. So by taking omeprazole, the chances of dash benign polyps might exist even if symptoms are relieved by its use. So the answer is benign polyps. Okay, you need to match the keywords. Okay, match the keywords. If you match the keywords, you can easily find the answer. This is not cancer. Cancer cannot exist. So there are two possibilities: cancer and polyps. If we say there is no association between PPI use and cancer, so the chances of benign polyps might exist even if symptoms are relieved by its use. Okay. Okay, now let us move to next question. Next question, which type of medication should be given to a patient whose heartburn is incompletely relieved by H2RA? In which text? In which text? Which type of medication should be given to a patient whose heartburn is incompletely relieved by H2RA? In which text you can find the answer? In which text? In which text you can find the answer? Okay, very good. Which type of medication should be given to a patient whose heartburn is incompletely relieved by H2RA? In which text? C, B, or B? Is B, okay? So let me copy the question here again. Okay, this is the question. Which type of medication should be given to a patient whose heartburn is incompletely relieved by H2RA? So please try to find the answer here. I'm showing the question again. Which type of medication should be given to a patient whose heartburn is incompletely relieved by H2RA? H2RA. Which type of medication? So please try to find the answer and write in the chat, please. Can you hear me? Okay. So what was the answer for this question? Uh, okay. So actually, Miss Sheba is writing that pain modulators, tricyclic, and then SSRI, and then Transudane. So pain modulators in brackets, all names, PPI, pain modulator. Actually, people, this is the trick. This is the trick. What the examiner, okay, what the examiner wants. Actually, you know, I work in a hospital, so I live in the hospital. So sometimes I get some patients, so I go to see them. So please, if I'm silent for some time, please wait. Okay, don't leave the class. Okay, so the trick is the type of medication. The question is which type of medication? Which type of medication? So it would be pain modulators. If HR, H2RA, H2RA is mentioned here also, but there is no mention what to do if H2RA fails. If H2RA fails, then we will give pain modulators. Okay, we don't need to give their names, just pain modulators. This should be the answer, pain modulators. Okay, just pain modulators. Okay, so now let us move to the next question. So next question. Okay. Okay. So the next question is, according to statistics, if a pregnant woman takes omeprazole, there is no change in dash. In which text we can find the answer? In which text? According to statistics, if a pregnant woman takes omeprazole, there is no change in dash. What should be the answer? In which text? Okay, text D, of course, we are talking about breastfeeding and these things in text D. Okay, so let us go to text D. Okay, this part of text D. So here is the question. Let me make it a little bit smaller. So here is the question and here is the text. So please try to find the answer quickly, please. What is the answer? What is the answer? Quickly, you need to find the quickly. No, this is the text. You need to give me the exact answer. This is the fill in the blank. Breast milk, very good. Where is the answer breast milk? So the answer is here, statistics. Okay, data, I'm using the word data here. And this is statistics, this is data, this is synonym. People, this is data, this is statistics. So this is the synonym. Epidemiology data means statistics indicate that do not show an increased risk of major birth defects after maternal use of omeprazole during pregnancy. According to statistics, if a pregnant woman takes omeprazole, there is no change in means there no show an increased risk of means there is no change in major birth defects. So answer is major birth defects. Very good. Okay. So the next question is, efficacy of which medication can be decreased due to use of PPI? In which text you can find the answer? Efficacy of which medication can be decreased due to use of PPI? In which text? In which text? The problem is you need to try to be a little bit quick, because if you spend 1 hour, everybody can answer. So main thing is to answer in 15 minutes. Try to find the answer here, please. Try to find answer here in text C. Okay, so there should be name of some medication, efficacy of which medication can be decreased with the use of. Okay, in C, but what is the answer? Please give the exact answer. The text is C, text is in front of you, please. What is the answer? Try to find here. Okay. So you need to be very quick. Doing skimming and scanning, quick skimming and scanning, okay? So which bullet point? This is 1, 2, 3, 4, 5, 6, 7, 8, 9. There are 9 bullet points. So what is the answer? So what is the answer? Methotrexate. What is the answer? What is the answer? What is the answer? This is fill in the blank. What is the answer? 6 bullet point. What is the answer? Clopidogrel. Okay, very good. So this is the medication whose efficacy is reduced. PPI may decrease the efficacy of clopidogrel by reducing the formation of active metabolites. Okay. So the answer is clopidogrel. Okay. Efficacy of which medication? Clopidogrel. Next question is, so we have done 16. Now number 17. We will complete today 20 questions. Some people cannot wait for me. You people know I'm a working doctor, so I'm living in a hospital. So if sometimes I go silent, it means I'm a little bit busy. You should wait for me, okay? What should be done if a patient experiences red flag symptoms after taking PPI for 8 weeks? What should be done if a patient experiences red flag symptoms after taking PPI for 8 weeks? So in which text it is possible? In which text? In which text it is possible to find the answer? In which text? In which text it is possible to find the answer? B, C, C. Okay, so most of you are saying C. So let us go to C. So let me copy the question. Okay, so majority of you are saying C. I will go to C. This is text C. And this is your question. So please try to quickly find the answer. Where is the answer? In text C, what is the answer? What should be done if a patient experiences red flag symptoms after taking PPI for 8 weeks? 8 weeks. 8 weeks is the keyword. Can you find anywhere 8 weeks in text C? This is the keyword. Or 2 months, maybe 2 months. 8 weeks is equal to 2 months, maybe 2 months, maybe 8 weeks. Red flag symptoms, what could be the synonym of red flag symptoms? Mean serious symptoms. Okay. What should be done? So there are two keywords, 8 weeks and red flag symptoms. Not in C. Let us go to text D. Okay, try to find here. Try to find here, please. Match your keywords. Match your keywords, please. Keywords. Okay, so is there any answer here? The question is, what should be done? Symptoms after taking omeprazole PPI for 8 weeks. Is there any mention of You can see the synonyms here. Some people are saying serious gastric problems, where it is written serious gastric problems, but there are no keywords. You cannot match your keywords. What are your keywords here? What should be done if a patient experiences red flag symptoms after taking PPI for 8 weeks? There are no, you cannot find your keywords here, okay? No keywords here. Try to find here in the text B. Try to find the answer here, please, quickly go to A, why A, Miss Manil, why A? Okay, we are in B. Let's give me the answer, please. We are already in text B. What is the answer? What is the answer? What are your keywords? Match your keywords. Esophageal impedance, very good, excellent, excellent. Esophageal impedance, okay. So if you take omeprazole for 2 months, then we will go esophageal impedance, very good. Review proper dosing, time and compliance, very good, excellent, excellent. You people are genius, really. You can easily pass your reading. Match your keywords. Keywords, please. What are keywords? Taking PPI for 8 weeks, number one. Number two, red flag symptoms. Red flag symptoms, please. So this is wrong because there is no mention of red flag symptoms. There is no mention. There is mention of 2 months, 8 weeks, taking PPI for 8 weeks. There is mention of that, but there is no mention of red flag symptoms. If you go here, if you see here, what is written here? Alarm symptoms. Alarm symptoms mean switch to another PPI. No, it is wrong. Switch to another PPI is wrong. So alarm symptoms here, if we take PPI for 2 months, means for 8 weeks, and still there are red alarm symptoms, red flag symptoms, alarm symptoms, what we need to do is upper endoscopy. We need to do upper endoscopy, okay? Upper endoscopy, this is the answer. So you believe me, how much time you will spend in this question? First, you will read the question, you will go to, we have gone to part C, then we have searched in part D, then there was no answer, then we went to the part B, and then we were able to find the answer after spending a lot of time. So this is how you waste your time if you don't do scheming and scanning at the start, and if you don't find the questions answers quickly, okay? Okay. Serum concentration of which medication can be increased if it is given with PPI? In which text you can find this answer? Serum concentration of which medication can be increased if it is given with PPIs? In which text you can find the answer? C. Okay, let us go to C and you will find the answer D or C. So here is C. Here is C. And here is the question, okay? Try to find the answer quickly, please. Quickly. Try to find the answer quickly, please. This you should have done during skimming and scanning, okay? The main things you should have done during, okay? May elevate or prolong serum concentration of methotrexate or its metabolite when administered together with proton pump inhibitor, possibly leading to toxicity. Consider a temporary withdrawal of PPI therapy with high dose methotrexate administration. Serum concentration of which medication can be increased if it is given with PPI? Methotrexate, okay? So the answer is methotrexate. Very good, excellent. So the next question is, which medical condition, can be disguised if PPIs are given for a long time? In which text? You can find the answer in which text. Which medical condition can be disguised if PPIs are given for a long time? In which text? In which text you can find, okay, D. Let us go to D. Here is D. Okay, sorry. Here is the question. Try to find the answer, please. Here is the question. Try to find the answer, please. What is the answer, please? Quickly. What is the answer? Dementia. Very good. Excellent. Very good. Dr. Nadeem, very good. Ms. Sadaf, very good. Dr. Abdullah Khan, very good. Dr. Suzu, very good. Excellent. Very good. Dr. Mohsin, very good. Dr. Miss Noble Moon, very good. Miss Sheba, very good. Excellent. Excellent. You people will rock, okay? You people will pass reading with 400 marks. Very good. 400 for all of you. So what are your very good? Umme, Saja, Zara, very good. Dementia, very good. Why it is dementia? Why it is dementia? Why? Why it is dementia? Why it is dementia? Why? Very good. Medical condition, very good. What are other words? What are the keywords? Can anybody tell me the keywords? Can anybody tell me the keywords here in this question? Keywords, medical condition, what else? Medical condition, what else? The keywords. The keywords. The keywords, please. Disguise. Okay. What are the synonym of disguise? Synonyms of disguise. Long-term use. Okay, very good. Long-term use, disguise. What are the synonym of disguise? There is a possible association between long-term use and dementia, which require the further study to confirm. Is there any disguise here? Any disguise here? Any disguise here? In dementia? No. It is wrong. Dementia, no. Dementia is wrong. There is no disguise. Here is your answer. PPI, use of PPI may mask gastric cancers or other serious gastric problems, and physicians should be aware of this effect. So the heading is long-term use. The heading is long-term use. Heading is long-term use. And here the use of PPI may mask gastric cancer, other serious gastric problems. So my question is medical condition. So other gastric problem is not a medical condition. The medical condition is only gastric cancers. Okay. So what should be the answer? Gastric cancer. People, please, please, when you do reading, do critical analysis. Okay. Concentrate, do critical analysis. The examiner is just doing a little bit trick to fail you. If you go behind the trick of examiner, you will fail. If you can confront that, if you can find where the trick, how to find the correct answer, then you can easily pass. Okay. So if you don't know what does disguise or mask mean, then you can easily get this question wrong. Okay. So the answer is not dementia. The answer is gastric cancer, and long-term use is already, the heading is long-term use. Okay. So answer is gastric cancer. Is interesting or not? What do you think? So the last question today, adherence to PPIs and their dash should be reviewed. Adherence to PPI and their dash should be reviewed if a patient tests are positive for acid reflux. Okay. So where, in which text we can find the answer? Adherence to PPI. Adherence to PPIs and their dash should be reviewed if a patient's tests are positive for acid reflux. In which text? B. Okay. So here is text B. Here is your question, and here is, please try to find the answer. I'm coming back in 1 minute to see a patient. Try to find the answer. Don't leave the class. Try to find the answer, please. Write the answer in chat. So the answer, PPI, dosing time, dose. Okay. Adherence to PPI and their dash should be reviewed if a patient's tests are positive for acid reflux. Okay. Whereas tests positive for, these are the tests, esophageal impedance plus pH. These are the tests. Okay. You should know. Okay. So these are the tests. Okay. And then if they are negative, this is not our problem. Positive for weekly acid reflux. Okay. Okay, so this is not our question. This is positive for acid reflux. Positive for if the patient's tests are positive for acid reflux, adherence to PPI, compliance is wrong. Okay, compliance mean already adherence mean compliance. So adherence or compliance to PPI and their dosing time should be reviewed. Review again what compliance mean adherence, and the second is dosing time. So adherence to PPIs and their dosing time should be reviewed if a patient's tests are positive for acid reflux. Okay. So thank you so much. If you have any questions, you can ask me on my WhatsApp number. You have my WhatsApp number. Please, at any time, if you see that I'm not responding or there is no sound, wait, please wait. Okay. Because I work in the hospital. I live in the hospital. Sometimes I get patients. So I need to see them on urgent basis. So wait a little bit. Okay. You can see almost 20 people have left. So this is not good. Okay. This is free class. If you people don't take too much interest, then I will also be not taking interest, and then I will be not taking free classes. Okay. So please, if you start watching class, so watch till the end. Okay. Okay. So thank you so much. And if you have any questions, you can ask me on my WhatsApp number. Thank you so much.